Okay, so just a comment about data before we move forward. Things are moving so quickly right now. A lot of this data can lag by up to 5 days or more. So we do have some internal data from our department, but even that lags just because the tsunami of data points that we're dealing with. So I know some constituents, they want to know like a pure number and then it's a true number. But when things are moving so fast like this, it's really, these numbers really paint a picture. And so I just want to clarify that there's delays in data and we're doing our best to get the clearest picture we can to the public. So with that said, this is our heat map, which I believe was updated on the 12th or 13th. And when we saw each other last week, the high transmission counties were 99 point something percent. And now I believe it's a little bit higher, but it's basically all the counties in the country are high transmission counties. Looking at the case rate, again, this data lags by 6 days, and I believe tomorrow they will update this. But the 7-day moving average compared to the week prior showed that the cases increased 33%. There is some talk that on the East Coast, they may be seeing a peak in their cases and that case rates may start falling, but this Omicron wave was a little delayed getting to Washington State, so we might be a little bit behind that curve. Hospitalization rates have been going up. We talked a little bit before about what they were seeing in other countries, especially South Africa, that there was a decoupling between case rates, hospitalizations, and deaths. And Omicron does seem to be less severe, if you will, but in the United States, we're not seeing quite the uncoupling of the hospitalizations that they were seeing in other countries. So it's still a variant that warrants close attention, and the vaccines are our best tool to fight that. Looking at Washington State, the 14-day case rate curve is pictured here. And if you follow out to this peak here, the peak here was 2323. And these little tiny dots are incomplete data, and it looks like the case rates are going down. Again, that's incomplete data. We have seen this. It doesn't mean that the case rates are going down based on this graph, but in conversations with Department of Health, there is some hint on the west side that the cases might be plateauing and potentially maybe going down, but it's just too hard to tell at this stage. It's going to take more time to sort that out. Likewise, as of January 12 or 13, this is the case rate ranking throughout the state, and Walla Walla is 22nd here. And based on the most recent published case rate data, this is where we stand, but I'll show you our Walla Walla specific data, and it's dramatically different than what this slide shows. But again, things are moving so quickly, and we're not the only ones going up. Almost every county is going up. So this is the Walla Walla case rate curve. I don't have the full year, but we're at some of the highest case rates that we've seen. According to the incomplete data, it looks like the case rate's going down, but if you look at our internal data, case rates are actually going up. There was a little drop between the 16th and 17th. Today, we received notification of quite a few cases. I don't know the exact number, but those need to be reconciled. And because of the increased cases, it's just hard to sift through all of this. So there's going to be a little bit of a lag in the data, but the message is the case rates seem to be continuing to go up. Looking at Walla Walla hospitalizations, this is the graph that the Department of Health put up and showed as of January 13 that our hospitalizations were going up. We've seen this a couple weeks ago. We were 5 and lower, and then we hovered around 10 cases. As of Friday, we had 17 cases, and this morning the hospital reported that there are 18 cases in the hospital, and there's still a sizable number of these cases that are unvaccinated. And we are trying to get clarification from the hospital and having them track moving forward, designating whether or not they're up to date with their vaccinations or unvaccinated, because we are seeing some breakthrough cases with COVID. And the majority of these are from Walla Walla County. Looking at vaccines in our valley last week through Department of Community Health, we had 3 Southgate clinics and 3 mobile clinics. We're still predominantly doing boosters, but it was nice to see that we almost had 100 people initiating vaccines at this time. And also, today is our 1-year anniversary. I wasn't sure if I should put this celebratory picture, but a year ago today, we had our first pop-up mass vaccination clinic at Walla Walla University Church. We received notification at about 3:30 on a Sunday that the governor wanted us to start doing mass vaccination clinics. And so in less than 18 hours, our community came together and put on that first clinic. So looking back, I'm just proud of the Department of Community Health and all of our excellent workers and managers and volunteers. And I also think about the lives that we've saved in our county. So I'm grateful to be a part of that. Testing has gone up significantly. You may recall that we were hovering between 50 and 75 tests per day, and then the test went down to somewhere between 20 and 40 per day, and there was concern that the UW lab may divest some of its energy in our testing site. They did not, and now we're seeing that we're doing over 200 tests a day. As mentioned last week, the turnaround time has increased, and it's just a matter of testing supplies and volume, so they're trying to turn around as quickly as they can, but there will be delays of several days in getting test results back. Department of Health is about to announce free home kits for people to order individually. It's similar to the Say Yes home testing kits that the federal government program delivered about 2 months ago or so. It's going to be a similar platform, and I believe on the 21st, which is Friday, the Department of Health will announce that program to the public. We have received some of those test kits locally, and we won't be distributing those to individuals, but we'll be distributing those to some community partners to distribute. But after Friday, individuals should be able to order those tests for themselves. You know, we're in the middle of this Omicron wave, the most dramatic wave that we've had. And, you know, there is talk that it's less dangerous, but we're definitely seeing that it's still driving up hospitalizations. It's still causing deaths. We know that the vaccines are our best opportunity to protect yourself and others. And just want to continue to encourage people to get vaccinated. It's not too late, and get your booster, and encourage others to do the same. In our department and just talking to people around town, this is a very difficult time for people. We're tired of COVID. We're tired of masks. We're tired of the whole, all of it. But we're going to get through this, and we're going to get through this together. So I've certainly enjoyed and appreciated the support that we've gotten from the Board of Health and the commissioners, and that relationship has been important that to enable us to do the job that we've done. So I want to thank all of you for that, and just want to ask our community to continue to work together and help each other out and encourage each other, and we will get through this.